Good morning, everybody. It is time for the Orthopedic Minute, and our friends from DMOS Orthopedic Centers joining us in studio right now. We have Dr. Shane Cook joining us.
Good morning.
And we're in some NFL royalty. We just want to mention that you had a short stint with the Bills and the Saints, but now you are in Des Moines, and you are doing things to make people feel better.
That's correct. Yeah, I'm excited to be here. Thanks for having me.
Absolutely. So what exactly are we going to talk about today, Doc?
So today we're going to talk about a pretty common arthritic condition of the hand, or pain in the hand. It's base of the thumb arthritis. It affects people usually over the age of 40, and as we age, we kind of have this degenerative change of the hand that can cause some pains that can be confused for other conditions, but it's a pretty common condition that we see.
Now, you're talking about the thumb. Now, the first thing people are watching are going to say, oh, is it because we are on our devices and we're doing this, or is it just a natural process?
It can, it can be both. Most likely it's due to just natural processes. We don't really have a good answer of why it happens. It's a complex joint, and the cartilage just breaks down and people get arthritis. Other reasons that it can happen is because people injure the thumb early in life, and it kind of sets it up for arthritic changes and pain in the thumb down the road.
Okay, so I've heard of various types of arthritis. I've never heard of thumb arthritis. My mom's a hairdresser, so she's doing the the fingers and the thumb back and forth quite a bit and is dealing with it in other parts of her arm, but she's never mentioned thumb arthritis. So what exactly is that? Where are we feeling that pain, and how do we realize this might be an issue for us?
Yeah, great question. So the first complaint people will have is pain at the base of the thumb. It's not in the thumb.
Over near the wrist?
Yeah,
I was going to say, I've never heard of pain in the actual
Yeah, you're exactly right. So it
thumb.
can kind of be a misnomer for people to say I have thumb arthritis, but it's not up here, but it can be down here in the base of the thumb. So that's where most people complain. They kind of grab the base of their thumb and the pulp of their thumb right here, and they say it hurts down here.
It's like where the thumb connects to your, what you would think would be your hand.
Yeah, you're exactly right, to your wrist bones.
Okay. All right, so then, so does it swell up at all, or is it just sore, or how does that?
Yeah, so there can be several things that you can see. Number one is swelling, some redness, some irritation, pain with movement. You can also see that the thumb can start to displace slightly, and you can notice that your base of your thumb joint starts to look a little bit funny, maybe compared to the other one or compared to somebody else, or how it looked previous in life.
Now, is this a symmetrical condition, or could you have it on one and not the other?
It can be symmetrical, but it can be asymmetrical also, so you can have it on one side and not the other. It doesn't matter if you're right hand dominant or left hand dominant.
That was my next question. Yeah.
So it can come on either side. Sometimes some of the literature says it can actually be on the non-dominant hand, which doesn't make much sense. But you'll know when you have it. You'll have pain in the base of the thumb, and it'll affect you with daily activities.
Now, you mentioned this is kind of a complex area, which I know we have a lot more going on than we realize, and you brought in a model to kind of show us. What are you talking about that's complex in this area that's really causing this to be an issue?
Yeah, so your wrist has to connect to your hand at some point, and there's all these carpal bones in here. There's a few carpal bones, and your thumb has to connect to your wrist. And so there's a joint right down here if you look at the hand being like this.
Right.
The base of the thumb is down here, so it's not actually your thumb, but it's the base here, and this complex joint here just gets worn out over time, and it can create arthritis and be bone on bone. And it's down here where kind of the arthritis happens, and we can see it on x-rays and make diagnosis through your clinical picture and through x-rays.
Now, are the longer bones in that they still call phalanges with the thumb too? Is that right?
Yeah, very good. Okay. Yep, you have different phalanges. The fingers have 3 phalanges. The thumb, this is actually not at one of the phalanges. The phalanges are kind of the thumb that you move right here, but the base of the thumb is called the metacarpal, and then this is it's called the CMC joint, is where most people get arthritis. Although you can get arthritis anywhere.
We've heard of metacarpal injuries. You've heard about that all the time, and that's what we're talking about. That gives a first-hand look as what that is all about.
Yes, you're exactly right.
Okay, so let's say we've been diagnosed and we're dealing with some thumb arthritis. What are some treatments that we can do to help alleviate some of that pain?
So great question. So the first thing we try to do is conservative treatment.
Okay.
So one is ergonomic adjustment. So if something is bothering you during the day, to adjust your keyboard, things like that, to maybe offload the thumb.
Yep.
Another treatment option is bracing. You can go on Amazon or we have braces available. If you come into my clinic, I'd have braces.
Is that more of a glove, or is it an actual rigid structure?
Yeah, so that's a great question. So there's actually 2 kinds. There's more of a rigid structure that'll hold it in place, and one kind of neoprene sleeve that can kind of give you support but not limit your function as much.
Okay.
So those are options. And then once we start getting into more therapy that's directed by myself, would be things like injections, physical therapy, and then if you fail all those, then the ultimate is surgical intervention.
Okay.
Now, you mentioned different things you can hit to alleviate the pain. I hear some folks that have this type of pain and they go in for regular shots. And is that recommended, or would you rather do something different?
Yeah, I think patients get to the point where they do have injections because they failed anti-inflammatories, bracing, things such as that, and injections are one modality to decrease the pain. It's all about pain and function. So it decreases the pain and can get them through a long period of time with avoiding surgery.
I was going to say, is it one of those, if your body's telling you something's not right and you go to an expert like yourself, can it be reversed almost? Like, can you get it back to a normal state, or are you always going to be dealing with
Yeah,
that?
so I think orthopedic science is trying to find a reversal to arthritis, but it's not there in knees, hips, anywhere. Same thing here. You're never going to reverse the arthritic process, but we can make the pain better and increase function with our modality.
Okay, so you have something going on with your thumb now, and you're getting it corrected now. Is that an indication that potentially down the road, some of the other fingers or some of the other things might have the same type of problems? Is that an indicator or not?
Yeah, it can be. I think some people have isolated just single thumb arthritis.
Really?
Yeah, and that's all that bothers them, and once you take care of that, they're fine. But other people will have arthritis throughout their hand. So
Wow, that's amazing.
Yeah, kind of a case-to-case basis, but we just want to make you aware of something new I'm hearing for the first time today. So there are surgical options if it gets to that point, and that's why you guys are the expert to kind of let us know what those options are and things you can do to make sure that you're able to function in the most comfortable way possible.
yeah, so surgical options, the first one's kind of these long words that we do, but the main thing is we take out the bone that's arthritic. It's different. I know Dr. Bremner is in here and talked about a replacement of a joint. This one, we typically take out the bone that's arthritic and we put a tendon in there from your own body that you don't need, and we tuck it in there, and it creates kind of this pillow on it and a suspension of the bone, and it's actually a very successful surgery. People do quite well with it.
And how long will that last then?
Nice.
That hopefully should last a lifetime. Younger patients, we think of different options. You know, we'd like to wait as long as possible, but it should be a definitive procedure.
And you say it's a tendon from a different portion of your body. What portion of your body is that?
It's actually one of the many wrist flexors that we have. I take the tendon from there, but there's other options that other physicians may do and take other, some thumb tendons and all that and put them in there. But yeah, it's a good surgery.
Wow, so a lot of different options in
Yeah.
case you have pain in your thumb.
Absolutely. Okay, so if people want to learn more, they want to get in touch with you, doctor, how can they do so?
Yeah, you can call our main office, DMOS Orthopedic Surgeons, 515-224-1414. We'd love to hear from you and help you out.
All right, Dr.
There
Cook,
you
I
go.
think the best thing to say about your performance here today is
All right.
thumbs
Thank
up.
you.
I like it.